Today, we're going to talk about an incredibly important topic. Lupus fog, cognitive dysfunction, memory problems is one of the most common problems in lupus, and it's such an important problem that affects quality of life. But there's so many things that you can do to help yourselves, and that's one of the biggest things I want people to get out of this talk are things that you can proactively do to help yourself. But first, before I get started, I'd like to introduce you to a patient of mine. So this is Ben. That's not really his name. It's not this is not really his picture, but it kind of looks similar to him but without the beard. But I've known Ben for over 20 years. When I first met him, he was in his 30s. And he's truly a rocket scientist. Yes, he is that smart. Well, he came to me with a new diagnosis of systemic lupus erythematosus. He had polyarthritis, rashes, horrible fatigue, and one of his major problems that bothered him was his memory. You know, being a rocket scientist, his memory was so important, but it was so severe that he unfortunately ended up having to go on disability at an early age. I had tried every single medicine to help out Ben, methotrexate, mycophenolate, azathioprine, belimumab, which is also called Benlysta, but he failed all of those. All of those medicines helped him somewhat. His anti-double-stranded DNA would improve, his complement levels would improve, but he never went into true remission, which is always my goal, by the way. So in early 2022, finally we were able to get a medication called anifrolumab, or also called Safnello, which is an IV medication that works by inhibiting the activity of a certain inflammatory molecule called type 1 interferon. And so I placed Ben on that medication as soon as it became available. To be honest with you, I really was not that optimistic about how he would do. However, when I saw him 3 months after starting him on anifrolumab, and when I walked into the room, he was actually smiling. This was a man who always looked depressed. For many years, we just thought that his memory problems and his fatigue was due to depression and anxiety disorder. He saw a psychiatrist regularly, was on multiple medications. And for the very first time, he told me, Dr. Thomas, I don't even have to take naps anymore. I'm doing chores around the house, and I just feel like I can do so many more things since I've been on Safnello. That was a few years ago, and to this day, he's still in remission on Safnello with a normal anti-double-stranded DNA level, normal complements, and his energy level is back, and his memory is doing great. And at the end, I'll touch back with Ben and let you know a little bit more about how he's doing now. So we're going to talk about cognitive dysfunction in lupus. Cognitive dysfunction commonly is called lupus fog. It's a problem with memory, a problem with attention, concentration problems. But other things that go wrong is there's something called executive function. This is where people have difficulty with planning things, organizing things, problem solving, and also being quick at processing things. So any of you who are watching this, and I suspect all of you probably have lupus fog or cognitive dysfunction, can relate to these particular problems. So it's not just to deal with memory, but it's a lot more than that. It's a common problem. So some studies show that as many as 80% of systemic lupus patients have problems with cognitive dysfunction or lupus fog at some point. Other studies show lower percentages. There was a study that came out of the University of California, San Francisco in 2012. They did a formal study of their patients and used a particular definition for cognitive dysfunction and found it to be present in 15% of their patients. What those patients had in common, it was cognitive dysfunction and lupus fog was most common in those patients with high blood pressure, those patients who were obese, those patients who had a history of stroke, and also sedentary patients who didn't exercise, and also antiphospholipid antibodies. For those of you who don't know, about 30 to 50% of lupus patients are positive for antiphospholipid antibodies. The examples are anticardiolipin antibody, beta-2 glycoprotein 1 antibody, as well, and lupus anticoagulant. And if you don't know if you're positive for these antibodies, by the way, ask your rheumatologist. I offer my patients that they all need to be on at least hydroxychloroquine, but also I recommend that they consider low-dose aspirin. It may possibly help out as well. But all of these things, what they have in common is that they're associated with hardening of the arteries, or what we call peripheral vascular disease. When we do brain MRIs and other imaging studies on people with systemic lupus and cognitive dysfunction, small vessel disease is one of the most common things that we see. And that's a problem where there's hardening of the arteries. And just think about it, there's decreased blood flow going to multiple parts of the brain. And so it makes sense that that's probably one of the reasons to explain cognitive dysfunction in so many of our patients. There's also brain atrophy. Atrophy means that there's a shrinkage of parts of the brain, especially in the hippocampus and the amygdala. The importance of those particular areas is that those areas are important for memory and mood and how we interact with people. And so it makes sense that that would happen and be associated with memory problems. And also these particular problems of atrophy were particularly seen in people with higher disease activity from their systemic lupus. And so we get a hint that having more severe lupus is also associated with a higher chance of having cognitive dysfunction in our patients. And by the way, I'd just like to point out something too. One of the things that we teach and recommend to systemic lupus patients these days is to practice something called mindfulness. There's more and more research showing that patients or people who practice mindfulness every day, they're healthier than people who don't. Mindfulness can be as simple as doing breathing exercises 5 to 10 minutes a day. They actually did a study where they looked at people who practice mindfulness every day and people who don't, followed them over time, and then did imaging studies on them. And very interestingly, those who practiced mindfulness on a regular daily basis had their hippocampus was larger in size than those who don't, which was fascinating. And that's an important area for memory. So could daily mindfulness possibly help out with cognitive dysfunction? It's a possibility. I practice it, and what I do is I go to YouTube and I just type in 5-minute mindfulness breathing exercises, and it's very easy to find those on the internet. Just takes 5 to 10 minutes a day. Such an easy thing to do. So other potential causes of cognitive dysfunction: active systemic lupus erythematosus inflammation. That's not a big surprise. There's been identified multiple types of autoantibodies that are actually directed at brain cells and nerve cells and can actually cause permanent damage and death to the nerve cells. There has to be some sort of breach of what we call the blood-brain barrier. There's just a particular membrane that's called the blood-brain barrier that keeps the blood away from inside of the brain. But in people with active systemic lupus, there's a breach in that blood-brain barrier, and antibodies can go through it that can potentially attack the nerves. One of those important immune system molecules is actually type 1 interferon, and type 1 interferon can interact with a particular type of cell called microglia and cause inflammation and damage to the brain nerves. I find this fascinating, by the way, because that is exactly how anifrolumab or Saphnelo works. It decreases the activity of type 1 interferon. So just like in my patient. And by the way, we hate to go by this particular case, we call it an antidote. In other words, it's a case study, just one person who had a particular response to a medication. It doesn't prove, by the way, that Saphnelo or anifrolumab improves brain function. Could this just have happened, by sheer accident in this particular patient? It's a possibility. But I've known Ben for over 2 decades, and no therapy had ever done this to him as far as increasing energy and increasing memory. So I just have to wonder, could the anifrolumab have helped his memory by decreasing that type 1 interferon from damaging the cells in his brain? That's a possibility. So we also like to look for other treatable causes. If you have poor memory or lupus fog, make sure that your doctor tests you for certain things like thyroid disease, low vitamin B12 level, because those are treatable. Other things that are treatable are depression, anxiety disorder, and obstructive sleep apnea. Fibromyalgia occurs in about 30% of our systemic lupus patients, causing severe pain, fatigue, and memory problems in most patients. Steroids can actually cause it, and also lack of sleep. Just simply having less than 8 hours of sleep every night can cause problems with memory and the ability to think. And those are all things that people can improve upon. Very interestingly, when you look at studies and try to find treatments that can possibly help out with memory, exercise is one of the most important things. The experts in dementia, by the way, they tell us over and over again that the magic medicine the magic medicine for helping to decrease the risk of dementia is the water fountain at the gymnasium. And so I heard that from one dementia expert. And it's because exercise is the number one thing that's been shown to help decrease the risk of having dementia over time. There was a study done in 2012 in systemic lupus patients. These were women looking at what was associated with cognitive dysfunction and memory problems. And what that particular study showed is that those patients who exercise regularly, only 5% of them, 1 out of 20, had problems with cognitive dysfunction and memory problems. However, those who were sedentary and non-exercisers, 23% of them had memory problems and cognitive dysfunction. And by the way, I know that many of you watching this do have severe pain, severe fatigue, trouble with movement and exercising, and you might want to say that, well, I can't exercise, I'm too sick. Well, everyone can exercise. My dad, I still remember when he had a bone marrow transplant for his leukemia, his exercise was simply raising his arms and legs up and down in the bed, but he did it religiously every day because he knew that he could get himself out of that bed if he did it, and he eventually did, thank goodness. Anyone who's not sure how to exercise safely, just ask your physician for a referral to a physical therapist. The physical therapist can evaluate your medical condition and then design an effective and safe exercise regimen for you, so you can always do it. One way exercise probably helps out with memory, by the way, through multiple different mechanisms. Just think about it. If you do have that small vessel disease or hardening of the arteries in your brain, exercise can increase the blood flow to the brain, increase the amount of oxygen, the amount of nutrients that's going to the nerves of the brain. But it also does other things, such as this one of the most important things to do to help with getting a good quality and more sleep at night, for example. Depression is one of those treatable causes of memory problems. It's actually one of the criteria for diagnosing people with with depression. And we know that anywhere from 15 to 30% of our systemic lupus patients do have depression, and they absolutely have a higher risk of having memory problems. I encourage you to do this depression questionnaire. By the way, you can come back to this video later and do these questionnaires I'm going to show. But if you do the questionnaire, and if you get a score of at least 5 to 9, that suggests that you may have mild depression. But if your score is 10 or higher, you have a high chance of having depression. And if you have those scores, just go to your physician, show them the results of the test, ask them if you might have depression and if it should be treated or not, because it could possibly help out with your memory. Anxiety disorder can cause memory problems and is another treatable thing. So you can do this particular screening test called the GAD-7. Again, you can come back to this later, but if you score 5 or higher, you have a high chance of having anxiety disorder and not even knowing it. And by the way, most people with anxiety disorder and depression have no idea that they have it. So everyone, I would encourage you to take these tests. And if you score high on the test, please show it to your physician. By the way, all of you watching this, I know that you are educating yourself about how to get better with your lupus. And I always say that knowledge is power. And so knowing that you can take these tests and find these results and possibly help these things, that's really doing yourself a world of good by looking at these possibilities. Another thing that is associated with depression or with memory problems is obstructive sleep apnea. I'll never forget one of the first patients in whom I diagnosed sleep apnea. She was actually a woman with lupus, and after she went on her CPAP every night, one of the first things she told me when she came back at that first visit after starting the CPAP was that her memory was better, her energy was a lot better, and she was feeling much better. So there's a test that you can do called the Stop Bang questionnaire. If you answer any of these questions, like do you snore loudly, do you often feel tired, has anyone observed you stop breathing during sleeping, give yourself a point for any of those. And if you score 3 to 4, you're at a intermediate risk for sleep apnea. You should go to your doctor, show them the results, and ask them if you should have a sleep study to see if you might have a sleep disorder. If you score 5 points or higher, you're at high risk, and you should absolutely get a sleep study. And if you're a man, and if you have a high BMI, or also measure your neck, and if it's more than 40 centimeters, you're also at high risk for just having 2 points on the stop part of this questionnaire. Another problem is fibromyalgia, as I previously mentioned. Fibromyalgia, unfortunately, happens too often in our lupus patients. It causes trouble sleeping at night. Even those people who feel like they sleep throughout the night, they oftentimes wake up feeling unrefreshed in the mornings. When we do sleep studies on them, they have a fragmented sleep where they don't go into the deepest parts of sleep, and that increases their risk of having memory problems. And it is a treatable disorder. If you find that you have pain in multiple areas of your body, like your neck, your back, and your doctor's telling you that your lupus is actually doing good without much inflammation, you might have fibromyalgia, and make sure to ask your rheumatologist. So how can you cope with memory problems? Now I'm going to come to other practical things that you can do to help out. One of the most important is to try to reduce the hardening of the arteries that can contribute to memory problems. One is to eat healthy. I am a strong believer in eating an anti-inflammatory diet. There's more and more evidence with animal lupus models, but also humans, that eating an anti-inflammatory diet can be beneficial, not just for possibly decreasing inflammation in lupus, but even decreasing hardening of the arteries and other problems. We want to get people away from the standard American diet. You know, we all learn to eat unhealthy, or most of us do, just because of how things are in America. So the standard American diet, SAD, that's the SAD diet. We need to learn to stop eating that way, eat more fresh fruits and vegetables. Whole grains are really important. Eating foods that are high in probiotics to try to help the microbiome inside of the intestinal tract. And so I put a list of all of these healthy habits in one of my blog posts, and I put the website on there for my lupusencyclopedia.com. And if you go there, you can see an example of an anti-inflammatory diet. One doctor or group in California, they published an interesting paper just a few years ago with an anti-inflammatory diet. They call it the itis diet, and they actually showed that rheumatoid arthritis patients who practiced their diet had decreased inflammatory disease compared to rheumatoid arthritis patients who did not. And I also include that diet in my blog post as well. So there's a lot of interesting data out there about diet. Exercise regularly, of course. And then one of the most important things, one of the best habits you can get into is know your numbers. I love the patient who comes into my office and actually wants to know their numbers and asks me how to get them to be perfect. So you want to do your blood pressures at home. The American College of Cardiology now recommends that you do home blood pressures and not rely upon what we do in the office, because your home blood pressure readings are more accurate. So if you don't have a home blood pressure cuff, please get one. Amazon has a lot of good ones. Just look at the highest rated ones. And what I ask my patients to do is to check 3 blood pressures at home before every visit. Write them down and hand them to me. Hand them to your primary care doctor. And we want to get the top number below 125 and the bottom number below 80 all the time. If your blood pressure is 126 over 81, we need to step up on your blood pressure medication and get it under better control. A lot of people come to me actually, and they'll say, oh, my blood pressures are great. They've been in the 130s over 80s. That is not good blood pressure. You want to know your total cholesterol level, your LDL bad cholesterol level, and then a new one that we're checking these days is called lipoprotein A. It's a genetic type of bad cholesterol that clogs up the arteries. The goal for each of these is different in each person, and so I recommend to my patients that they see a cardiologist or their primary care provider and ask them what their goals are for those particular ones. Many lupologists or lupus experts, by the way, think that all lupus patients should be on a statin to decrease their cholesterol because of this problem. Also, it's interesting that statins also have anti-inflammatory properties as well and may actually help with lupus inflammation. You also want to make sure you have a perfect weight, whether it's by having your BMI normal, or BMIs are not very accurate, by the way, especially in people who exercise a lot, for example. So knowing your body fat percentage. And by the way to learn your body fat percentage is if your rheumatologist has a DEXA scan or a bone mineral density in their office, they can usually do something called body composition scanning. We do it in our office where we can tell you exactly what your percentage of lean body mass and lean body fat is, and you can monitor that over time with exercise and diet to ensure that you're going into a healthy percentage of lean body mass and less fat percentage. And then, of course, do not smoke. Smoking cigarettes, even secondhand smoke, is horrible in lupus patients. Not only does it help with increasing clogging of the arteries, but it actually makes lupus more difficult to control. It even decreases the effectiveness of the most important drug that we have to treat lupus, and that's hydroxychloroquine. We don't know why, but smoking cigarettes decreases its effectiveness. So what else can you do? I'm putting up here a list of things right directly from my book, The Lupus Encyclopedia. I put on there exercise regularly. Do not multitask. If you have memory problems, try to just do one thing at a time. If you try to multitask, and I know that many people feel like they're experts at multitasking, just stop doing it because it's too easy to make mistakes when you have cognitive dysfunction. Eliminate clutter. Simplifying your life and get rid of things that are not important can make a big difference. And then keeping organized, such as always keeping things in the same place. How often do we misplace our car keys, for example, or the remote control, or our smartphone? But if you always designate one place to put everything and always do that, it's much easier. And then educate or ask your family members to help out. Say, please, always, if you take something, if you use something, put it back where you found it. I'm always telling my family members that. Next is carry a small notepad. Some of my patients, they always come in with a notepad and write down everything. It is too difficult to remember everything. And by the way, always bring someone else to your doctor visits. I love it when a family member or a friend or a loved one comes in with them and that they help to write down instructions and what I say, because two heads are always better than one. Use sticky notes and just put them up in places to remind yourself. I actually have some right up here on my computer that helped me out as far as what I can do during lectures and stuff. So that can be very helpful. Keep a calendar all the time. I love the smartphone contacts area. Don't just use it for names and phone numbers and addresses, by the way. I use it for other things. For example, where I hid my car key or my house keys out in the yard, I put it underneath a certain rock, and so I just put it as a contact. where I hid my house keys outside. I love to use the contacts part just to remind myself of a lot of things like that above and beyond just people, addresses, and phone numbers. Ask that only one person speak at a time. When you're talking to people in a group, don't be bashful. If you feel comfortable, tell people that you have memory problems and that you have lupus, and ask them to help you out, and just say, could one person just talk at a time? That can make a big difference. During a conversation, be an active listener. How many of us like to say things and not really listen as much as we should? It's very common. So try to get into the habit when someone's talking to you. A lot of times we're inside of our head and we're thinking, okay, this person's saying this, but I should say this to them. No, they should be saying that. Stop doing that. Just listen very closely. Try to think about, have some empathy and compassion for that person, and try to absorb everything that they're saying, and ask them questions and be very interested in them. And if you do that, you're going to be able to remember much more. Don't be looking at your smartphone. Don't be looking out the window. Don't be looking at the TV when they're talking, and you can do a lot more with memory with what they were saying. Also, don't be afraid to ask people to repeat themselves. Again, try to not be bashful with having lupus and letting people know that you do have problems with memory. And then repeat things out loud or in your head, like, I am horrible with names. How many of you have difficulty remembering a new name with a person? One of the best things to do is to repeat their name several times out loud. And that can help you remember what their name is and put a name to a face. You can train your brain. There's actually, if you do crossword puzzles or solitaire or Scrabble, things that really force your brain to think, that's healthy for remembering things. But the trick is to do things that you're not very good with. They did a very interesting study where they took elderly men who didn't know how to crochet or knit, and they had half of them knit and crochet and taught them how to do it. The other half, they just let them do what they normally do. And the men who crocheted and learned how to knit, they actually had significant improvements in their memory. And we say that this is due to neuroplasticity, where the brain actually has the ability to make new neuronal connections with each other. But the best way to do that is to do things that you're really horrible at. If you're good with crossword puzzles, don't do crossword puzzles. Do Sudoku or some type of math thing instead. There's also some very good apps, by the way. Lumosity and Elevate. They're actually apps that give you brain training exercises that you can do 5 to 10 minutes a day. Start doing those. For example, Lumosity can actually give you a score and show how you compare to people your own age. After doing it for a couple of weeks, then start doing those games on the app that you're horrible with. Try to force your brain to do those and learn those new things. Other things, there's a very good memory book by Harry Lorraine. I highly recommend reading it. Keep your mind active. This is an important one. If you're retired or if you're not working, fight the urge to just relax. And a lot of people, they retire and they say, "Oh, I deserve to just relax and enjoy myself." But it's much better to become active, volunteer for things, and don't actually retire. Find new hobbies, for example. Challenge your brain by learning new skills. And I'm sorry, I have my little puppy here, and she went out. I'll be right back. Sorry about that. This is Musette.
Oh my goodness.
Also, get yourself a pet. Having a pet has been shown to have many health benefits, because it forces you to love someone else and interact with them. So I highly recommend it. I have 4 pets. Also, make sure to get treatment for those things I talked about: anxiety, depression, obstructive sleep apnea. Take those tests, like I said. You can go back and watch this video and do it again. Reduce stress. Absolutely. People who are stressed out and people who live with a lot of stress, they absolutely have more problems with remembering things and with cognitive dysfunction. When you have lupus, you're spending a ton of time just trying to take care of yourselves, seeing doctors all the time, taking so many medications, and stress absolutely does cause lupus to flare. We can't get rid of the stress in our lives. That's something we don't have any control over, but we do have control over how our body responds to stress. People who respond to stress in a healthier way, they're actually much healthier, and they're much more likely to have good memories than people who don't. And by the way, people who are stressed out a lot, you can actually learn to train yourself to learn to teach your body to respond to stress in a better way. And I'm going to come to that in just a little bit as well. For example, just saying no when people ask you to do things that are not truly important in your life. I just saw a nurse practitioner yesterday who has severe systemic lupus, and she was having a severe flare. And she's one of those people who has a family. She works her butt off as a nurse practitioner, and she's constantly saying yes to doing things in her life. And I had to tell her, please start learning to say no. Just do those things that are absolutely essential. Those things where you have to, that you need to do to take care of your kids and have your occupation, but don't do all those extra things like being, going on a committee or giving an extra lecture and things just like that, or doing things for the PTA. Next is be open about your memory problems with others. I already mentioned that. And get plenty of high quality sleep. Having less than 8 hours of sleep per night absolutely can decrease memory and cause difficulties. Also, having an abnormal quality of sleep. You can try to get 8 hours of sleep, but you could keep waking up in the middle of the night, and that's not good. There's something called sleep hygiene techniques. If you go to my website and you click on Lupus Secrets at the very bottom, I have a free handout you can print out about sleep hygiene techniques that can help you have a better quality sleep at night. But the sleep experts these days recommend something called cognitive behavioral therapy for insomnia. And that's why I have highlighted there CBT-I. There are some smartphone apps out there. There's also there's some courses that you can take on the internet as well. I highly encourage you to, if you have sleep problems, to download that and do the CBT-I. It's been shown to be the most helpful thing for improving sleep quality and sleep quantity. Also, these days, there's a lot of clinics that offer help with memory problems these days. For example, there's closed head injury clinics that specialize in memory. There's dementia clinics. There's actually memory loss clinics. These are usually at large medical centers. For example, I'm in the Washington, D.C. area, and I know that George Washington has one of these clinics, and some of my patients have found a lot of help from them. If you're working and you have memory problems, it can be devastating. It can make it difficult for you to keep up with your work. And then if you lose your job, you can lose your health benefits, and then that's just catastrophic for lupus patients. But you know what? You do have rights. You do have rights under the Americans with Disabilities Act, and so I would highly encourage you to go to the Job Accommodation Network. It's askjan.org, and they can provide you some recommendations on how you can try to get some extra help at work so that they can work around your lupus problem. This slide here, it has that list of stress reduction techniques I told you about. And by the way, practicing mindfulness every day does improve the way your body responds to stress. And just for example, how many of us were very busy? We bought a whole bunch of stuff in the store. We get in there, all the lines are really long. We get into one line, and then there's the person at the front of the line who is slowly putting out coupon after coupon after coupon, then takes out their money bag, pennies and quarters, and they're taking forever. And then just inside, you're just boiling, thinking, oh, why did I pick the wrong line? A healthier way to respond to that, by the way, because when you get stressed about it, the adrenaline increases, and those kind of things are actually unhealthy to the body and to the brain. But the person who practices their mindfulness and takes in some slow, deep breaths and stays in the moment and tells themselves that they don't have any control over what's going on, they actually have a healthier response to that. So I hope you go through this list and can learn to do some of those. And then what happens in the long run? That's a big question that everyone with cognitive dysfunction and lupus fog want to know. Well, you know what? We truly don't know the answer. Unfortunately, the studies have some conflicting results. For example, this study came out called Intra-Individual Change in Cognitive Dysfunction in Adults with Systemic Lupus. And in this particular study, UCLA, they followed 1,281 systemic lupus adults over time. They used some verified tools to follow cognitive change. And what they showed over 7 years is that most patients did not change. Those who had mild cognitive dysfunction still had mild at the end of 7 years. Those with severe still had severe over 7 years. But there were some things that predicted who would get worse and who would get better. The people who got worse were associated with those with systemic lupus high disease activity. So you can actually do something about that, by the way. When we look at people with high disease activity, we know that there's things that they can do usually to help themselves get better. For example, taking hydroxychloroquine religiously, because when we look at people with active lupus and that's not under good control, 50% of them are not taking their hydroxychloroquine. And so I always check, and I know that because I check a hydroxychloroquine drug level. So if you have uncontrolled lupus, by the way, ask your doctor to please do a hydroxychloroquine drug level when you every visit. The reason for that is that we know if you're at a level of 1,000 or higher, your chances of having active disease or flares from your lupus are 4-fold compared to if it's less than 1,000. Also, if it's less than 1,200, your risk for eye problems is markedly lower. So between 1,000 and 1,200 is the magic place. And so if your lupus disease activity is active and you're less than that, I would go up on the dose of the hydroxychloroquine, for example. There's a lot of other things that you can do to help your lupus, by the way. I made up a list of things called the Lupus Secrets. Just go to my website, lupusencyclopedia.com. You don't have to buy the book, by the way. Just go to my website and click on Lupus Secrets. If you do every single thing on that list, I guarantee that you'll do better with your lupus. Also, patients who had depression. So this comes back to the thing, take that depression questionnaire. And if you do have a high score, show it to your doctor and get treatment for your depression, because that's a treatable cause of poor memory problems. Now, who got better in this study? Older individuals. I don't understand why that happened, but that was an interesting finding. You can't do anything about that except just keep living. And then those with higher education levels. So that's probably because these are people who are forcing their brains constantly to do things. I can just imagine that nurse practitioner with severe lupus. She's constantly forcing her brain to think about complicated things. So she's probably going to be at much lower risk of having cognitive dysfunction compared to other people with her particularly severe type of lupus. But there was another study from 2018. This was a large cohort in Italy where they also looked at their patients over 10 years. And what they showed at the beginning of the study is that around 1 out of every 5 of their lupus patients had significant cognitive dysfunction. At the end of 10 years, though, only 13%. So many of them actually got better and had no cognitive dysfunction at the end of 10 years. So that gives us some hope. 50% of the patients improved, only 10% of the patients got worse. So what that tells me is that if you know the tricks to getting better and improving your memory and putting into practice the things that I talked about, such as exercise, working on your sleep at night, doing the Lupus Secrets to control your lupus disease activity, I am hopeful that you can get better instead of getting worse. So will you get dementia? And we really don't know the truth about this, by the way, because there are some conflicting studies. Some studies show that there is not an increased risk of dementia in lupus patients, but a study came out a few years ago from Taiwan, and they showed that there was a twofold increased risk of dementia in systemic lupus patients. Now, interestingly, the authors associated it with hardening of the arteries. So that comes back to the very first part of my talk, where I mentioned that the most common thing we see on MRIs is hardening of the arteries in the brain. So exercising regularly, knowing your numbers and getting them perfect, eating an anti-inflammatory diet, so important for preventing that hardening of the arteries, or if you have it, to keep it from getting worse. So I'm almost to the end of my talk, and I like to come back to Ben. So whenever I see Ben these days, he's not depressed looking like he always used to before I put him on anifrolumab. He's always smiling like this, and he's always telling me about the things that he's doing in his house and working on chores and getting things better and not having to sleep all the time in the daytime. But what really struck me is that one of the most recent studies, or the most recent visits that I saw him, he said to me, "Dr. Thomas, I just wish I would have had Safnello a long time ago." He was just truly depressed over not being able to continue his job as a rocket scientist at NASA. And I just wish I could have had this 20 years ago to help. Now, I'm not saying, by the way, I'm on the Speakers Bureau of Safnello with AstraZeneca, just as a disclosure there. I'm not trying to sell Safnello, by the way, because I haven't seen this in any of my other patients with Safnello, but I hope they do a study to look at it. Bottom line is that if you have severe active systemic lupus, there is the possibility that your memory may improve with good treatment. But you also need to do all the other things that I mentioned. And if you do those things, and if you do my lupus secrets, I promise you that you'll have a better quality of life. And so, Brianna, I appreciate you having me here, and I'm open to answer any questions.
Awesome. We definitely have several. That was a great talk. Thank you, Dr. Thomas. It's such a huge topic that affects, I feel like, almost everyone that we speak to. So it's really helpful information to learn sort of a little bit more about the why and some things that can be done. One of the questions that we had from Ariane was, can being over medicated for a long period of time with prednisone cause permanent brain damage or headaches or cognitive issues? And if so, what can we do? We saw your slide earlier in the deck when you were talking about how steroids might come into play as a cause for lupus fog. Can you talk a little bit about that?
Yes, Ariana, I'm so glad that you mentioned that. You know, the first law of medicine is to first do no harm. Yet lupus is one of those diseases where one of the most common drugs that we use is absolutely guaranteed to cause our patients harm. When we look at our patients getting permanent organ damage over time, at the 1 year mark, 1 out of every 3 of our patients have permanent organ damage. At the 5th year, 50% of our patients have permanent organ damage, and on average, these are patients in their early 30s when we look at these studies. The number one cause of organ damage after the first few years is actually prednisone, steroids. Now, steroids are the only drug that immediately calm down inflammation. And so when we see a patient who first gets systemic lupus and it's bad, we have to use steroids because it's the only thing that works fast, and it does decrease organ damage used that way. But when we use it chronically, even in low doses, as low as 2 milligrams a day, we see permanent organ damage, and that includes hardening of the arteries and heart attacks and strokes. And so we want to do everything we can to get our patients 100% off of prednisone. If I have a patient, and by the way, in my clinic today, the vast majority of my patients are in remission or low disease activity, and I have very few patients on chronic steroids because the treatments we have today, the ability to use things like hydroxychloroquine drug levels, really improves disease activity in our patients. But Ariana, unfortunately, I do have those patients who have such severe disease and hard to control disease that even I can't get them off of prednisone. I even have one patient who relies upon 40 milligrams a day of prednisone. I just feel horrible that I can't get her prednisone down, but hopefully we'll get better therapies such as CAR T cell therapy that can hopefully help these patients in the long run. So you are correct, Ariana, and I just hope we keep getting better and better therapies. And by the way, this is where when you join Lupus LA and advocacy groups like this, and you contribute money for research, it's going to a good cause, because we do need to find better treatments and we do need to find a cure.
Yes, definitely. Thank you. How do I know if lupus fog is what I'm experiencing, or if it's something more serious like early dementia or a different condition?
And that is a great question. Me as a rheumatologist, I don't know. And what I do is in my patients, I recommend that they do the things I just talked about. But if they continue to have significant memory problems and lupus fog, I always send them to a neurologist, because a neurologist can do formal testing like neuropsych testing, and they're really the experts to really tell if it's dementia or not. Thank goodness, the vast majority of the time, my patients come back with a diagnosis of mild cognitive dysfunction. In other words, pure lupus fog and cognitive dysfunction. Still not a good thing, but much, much better than dementia. I have a very small percentage of patients who end up with a diagnosis of dementia, thank goodness. But that's really where you can tell us from a dementia expert like a neurologist.
Sure. I think you touched a little bit on this, but any supplements that could help with lupus brain fog from Lori?
Yes. You know what? Jellyfish, that supplement made out of jellyfish. Jellyfish are not very smart. I don't understand that supplement. Don't waste your money on supplements that promise that they'll improve memory. According to the memory experts, there is no supplement that's been proven. If there was, I would be giving it out like hotcakes. But there isn't anything that's been proven. Personally, I wouldn't waste my money. The best supplement, by the way, there is one supplement. The best supplement to help out with memory, and write this down, is the water fountain at the gym. Exercise. It's free.
Thank you, Dr. Thomas. We have several patients asking about Sjogren's as a comorbidity and that affecting brain fog. Is that something that affects brain fog more if you have the combination? Is that something that you see in co-conditions like POTS and Sjogren's?
I haven't seen a study to answer that question, but that would be a great study to do, because about around anywhere from 15 to 30% of our patients with systemic lupus have Sjogren's overlap. And by the way, it's probably significantly higher than that, because Sjogren's disease is underdiagnosed. And fortunately, we're working on better ways to diagnose it. I'm a member of the Sjogren's Foundation, so be on the lookout for that possibility in the near future. But right now, about 30% are formally diagnosed, and my clinic is about 50% of my patients. And we know that around 50% of Sjogren's disease patients, and by the way, those of you who don't know, Sjogren's is a sister autoimmune disease that's a sister to systemic lupus. It attacks the glands of the body, can cause dry eyes and dry mouth, dry itchy skin, dry vaginal area. And so if you have those things and you don't know you have Sjogren's, bring it up to your rheumatologist, because it is underdiagnosed. But up to 50% of Sjogren's patients have neurological involvement from their Sjogren's disease, including problems with cognitive dysfunction and CNS involvement. So that would be a great study to do. I wouldn't be surprised if those patients do have a higher prevalence of cognitive dysfunction, but we just got to wait for someone to formally study it.
Okay. Dr. Thomas, would you mind clicking out of your slides for a moment just so that we can see your face a little bit larger on the screen?
Oh, sure. Yes.
Thank you so much. I see
How's
another
that?
question about, great. We have another question about blood markers. Are there any blood markers or specific imaging tests that help with lupus-related brain involvement, or is that something that's really in the purview of the neurologist?
I don't know of any blood markers that actually are associated with cognitive dysfunction. As I mentioned, there's absolutely some autoantibodies that have been associated that actually cause direct brain injury. Actually, one of those is we can measure. It's called ribosomal P antibody.
Okay.
About 15% of systemic lupus patients. So you can ask your your doctor to measure ribosomal P antibodies, and I know that that one has been associated. There's another study that did show an increased prevalence of cognitive dysfunction in those with high anti-double-stranded DNA antibodies, and there's a whole bunch of other ones that they've identified, but the vast majority were not able to measure in the clinic yet. Probably the biggest thing is that, as I mentioned earlier in my presentation, is that patients with severe active disease are more likely to have cognitive dysfunction. So those biomarkers that we see with more active disease, like low complements and elevated anti-double-stranded DNA, by proxy, we could say that they're probably associated with it. But we don't have any pure biomarkers purely for cognitive dysfunction, except possibly that ribosomal P antibody.
Okay, got it. Um, how can I explain to friends and family about my cognitive issues without feeling misunderstood or ashamed?
That's a great question. And you know what? I am the wrong person to ask this. This is this is one of those things where I think that support groups, and Lupus LA has a lot of great support groups. I highly
They
recommend that you
do.
contact them, because this is the type of question you can bring up in a support group where you have people who have been living with the disease for a long time, can tell you, you know, the effective ways to do that, tactful ways to do it. And also, I'll just mention Reddit, reddit.com. They have a subreddit for lupus. Amazing community, because you can ask this type of question, and you can get such wonderful, thoughtful answers from the community of people living with lupus. That's where you need to find it from, as other lupus patients. Join a support group with Lupus LA. They also have a men's group, by the way, if you're a male.
Yes, we do. You can go to lupusla.org/support groups and get a list of all of the dates and times each month that we have and find what works best for you. But that's a great piece of advice. Um, do you have time for one more question?
Yep, absolutely.
Um, do you feel like in your practice and in your experience that lupus fog and the cognitive dysfunction that can come along with lupus gets progressively worse, or is it something that can be reversed or comes and goes? What have you seen?
Sure. So you know, earlier I mentioned those two different, very different studies. One study showing that people don't get better overall, but 10% of the patients did. And then there's that other study that showed that 50% of them got better over time. In my experience, the vast majority of people do get better. And I think, and I mentioned that how most of my patients now are in remission and low disease activity and off steroids. And I think that it has to do with getting the lupus under better control, my patients exercising. And by the way, I mentioned my lupus secrets earlier. If you go to my website, just click on lupus secrets at lupusencyclopedia.com. It's a list of things to do. I ask all my patients to do those things regularly, and those patients, they're the ones who get better over time. And so I do think that these things do work, such as exercise, working on sleep at night, learning how to deal with stress better, practicing mindfulness every day. You know, these are not magic cures, but the patients who do those things, they do so much better in the long run. And so be proactive in your healthcare, and they do get better.
Awesome. Thank you so much for your time, Dr. Thomas. This is really, really helpful. I'll leave the link to some of our services and support groups in the chat so that anyone who wants to access them can. And I'll also leave the link to Dr. Thomas's website so you can go check out the Lupus Secrets. Thank you so much for joining us.
You're welcome. And remember, knowledge is power. Thank you for having me.